Can you still have great sex after 65? Most doctors won't give you a straight answer, but I will. I'm Dr. Jessica Morgan, and for over 20 years I've specialized in men's prostate health here in the U.S. And let me tell you something. The conversation I'm about to have with you is the one that happens behind closed doors in my office. The one where men finally ask what they've been afraid to say out loud. Last month, a 68-year-old patient sat across from me. His wife was in the waiting room. He looked down at his hands and said, "Doc, I don't know if things will ever be the same." He wasn't talking about his PSA levels. He was talking about intimacy. And you know what? I see this every single week. Men who think that after a certain age or after prostate issues start, their intimate life is just over. But here's what I told him, and what I'm telling you today. It doesn't have to be. Here's the truth nobody prepares you for. Your prostate changes as you age. That's not a disease, that's biology, but those changes absolutely affect your sexual function. And modern medicine, it often makes things worse. You go to your urologist because you're getting up 3 times a night to pee. He prescribes medication, maybe Flomax, maybe finasteride. You feel relief, but then something else changes. Your libido drops. Ejaculation feels different or doesn't happen at all. You lose that morning firmness you used to take for granted. Did your doctor warn you this might happen? Probably not. And when you mention it, he might say, well, that's just part of getting older. But is it? Let me tell you what they don't put on the prescription label. Medications like finasteride, used to shrink the prostate, can reduce your libido by up to 15%. Some men experience what's called retrograde ejaculation, where semen goes backward into the bladder instead of out. It's not dangerous, but it changes everything about the experience. Alpha blockers like tamsulosin can cause dizziness, fatigue, and yes, erectile difficulties in some men. I'm not saying don't take these medications. For many men, they're necessary, but you deserve to know the full picture. Here's what frustrates me. We treat the prostate like it's separate from your sexuality. It's not. These systems are deeply connected. Personal story. I had a patient, 72 years old, who told me he and his wife hadn't been intimate in 2 years. He thought it was over. He'd stopped even trying. We sat down and talked, really talked, about what had changed, what medications he was on, what he missed. Within 3 months, after some adjustments and honest conversations with his wife, he came back smiling. "Doc," he said, "I didn't think this was possible anymore." It was possible. He just needed the right information. So let's get into what's actually happening. Your prostate sits right below your bladder, wrapped around your urethra. It's involved in producing seminal fluid. When it enlarges, which happens to most men over 60, it can press on nerves and blood vessels that are crucial for erections and sensation. Prostate inflammation, even mild, can cause discomfort during or after sex. Some men avoid intimacy because it hurts, not because they're not interested. And here's something almost nobody talks about. Your pelvic floor muscles matter. Just like women do Kegels, men need strong pelvic muscles for firm erections and ejaculatory control. But after 65, these muscles weaken, and most guys have never even heard they should exercise them. Are you starting to see the bigger picture here? The shift. Now here's the good news, and I mean really good news. You can absolutely maintain a fulfilling, intimate life after 65. But it requires understanding what's changed and adapting intelligently. Let me walk you through what actually works. 4. First, strengthen your pelvic floor. I know you've never thought about this, but these muscles control both urination and sexual function. When they're weak, everything suffers. Here's a simple exercise. Next time you urinate, try to stop the flow midstream. Those are your pelvic muscles. Practice contracting them. Hold for 5 seconds, release for 5 seconds. Do this 10 times, 3 times a day. Within a few weeks, most men notice stronger erections and better control. One of my patients called it a game changer. His words, not mine. Second, review your medications with your doctor. If you're on prostate medication and experiencing sexual side effects, ask about alternatives. Sometimes switching from one alpha blocker to another makes all the difference. Sometimes adjusting the dose helps. Don't suffer in silence. Your doctor can't fix what you don't mention. And if your doctor dismisses your concerns, find a new doctor. Your quality of life matters. Solution 3. Lifestyle factors. Third, address inflammation through diet and exercise. I've seen men improve dramatically just by cutting down inflammatory foods, excess red meat, processed foods, too much alcohol, and adding more omega-3s, leafy greens, and tomatoes. Why? Because chronic inflammation worsens prostate swelling and affects blood flow. Better blood flow means better sexual function. It's that simple. Regular walking, even 30 minutes a day, improves circulation to the pelvic region. Combine that with strength training twice a week, and you're supporting healthy testosterone levels naturally. This isn't about becoming a bodybuilder. It's about keeping your body functional. Solution 4. Communication. Fourth, and this is huge, talk to your partner. I cannot tell you how many men avoid intimacy because they're embarrassed about changes in their body. Meanwhile, their partner thinks they're no longer attracted to them. That silence creates distance. Have an honest conversation. Explain what's changed physically. Explore what feels good now. Intimacy isn't just about one type of performance. It's about connection, pleasure, and presence. Some of the happiest couples I work with are the ones who got creative after 65. They discovered new ways to be close that they'd never tried before. Now, I need to be honest with you about something. Not everything will be exactly like it was at 40. Your refractory period, the time between erections, will be longer. Ejaculation might feel less intense. Morning erections might be less frequent. But here's what most men don't realize. Satisfaction doesn't require the same intensity. What it requires is presence, connection, and realistic expectations. I've had patients in their 70s tell me their intimate life is better now than it was in their 50s because they stopped chasing performance and started enjoying the experience. Think about that for a moment. Adrenal pull. I know some of you watching this are thinking, it's too late for me. Maybe you haven't been intimate in months, maybe years. Maybe you've tried and it didn't work, and the embarrassment was too much. I get it, I really do, but it's not too late. Your body is still capable of pleasure. Your prostate, even if enlarged, doesn't eliminate your ability to connect with your partner. And the steps I just shared, they work at any age. One of my patients started pelvic floor exercises at 74. Within 2 months, he told me he felt a difference he didn't think possible. You can do this, but you have to start. Here's when you should absolutely talk to a specialist. If you have pain during or after sex, that's not normal, even with an enlarged prostate. It could be prostatitis or another issue that's treatable. If you've completely lost interest in intimacy and it's affecting your relationship or mental health, low libido can signal low testosterone, depression, or medication side effects. If you're unable to achieve any erection, even with stimulation, this could indicate vascular issues that need medical evaluation. Don't ignore these signs. They're your body asking for help. Here's what I want you to take away from this. Your prostate health and your intimate life are connected, but one doesn't have to destroy the other. Modern medicine gives us tools, but it doesn't give us the whole conversation. That's what I'm here for. You deserve to feel like yourself. You deserve pleasure, connection, and intimacy at any age. And with the right approach, you can have it. So here's what I want you to do. Start with one thing this week. Maybe it's the pelvic floor exercise. Maybe it's a conversation with your partner. Maybe it's scheduling that appointment you've been putting off. Just start. And if this video helped you, leave a comment below. Tell me what you're dealing with. I read every single one, and your question might become my next video. Next week, I'm covering something even more controversial. The medication side effect your urologist probably didn't mention, and what you can do about it. Hit subscribe so you don't miss it. I'm Dr. Jessica Morgan. Stay strong, stay informed, and remember, your health is worth fighting for.